Hi, my name is Alex Goel, and today I'm going to be discussing the Mobile Aggregate Data Exchange Profile, or mADX, under Quality Research in Public Health in IHE. mADX supports interoperable public health reporting of aggregate data. The motivating context and use cases for this profile are the same as the Aggregate Data Exchange Profile, also under QUIRF. The FIRE measure is used to define a mADX message, and FIRE measure report is used as a representation of that message. mADX leverages the HL7 FIRE terminology services and the IHE Mobile Care Services Discovery profile. mADX is part of a larger ecosystem of computable care guidelines. mADX is used for health system monitoring and calculating indicators from anonymized data. There is a CQL white paper that describes this in further detail. Computable care assets can take us from Level 1 narrative guidelines to Level 4 executable computable care guidelines, which can be implemented in digital health systems. mADX can help provide indicators to facilitate this guideline creation. The two required actors in mADX are the content creator responsible for submitting the file to the second actor, the content consumer. Both actors should send and receive files respectively that are conformant to the defined measure. The optional actors and transactions in mADX are the content data structure creator, which is responsible for creating this measure, the content data structure consumer, which is responsible for consuming this measure, the care services update supplier, which is an MCSD actor responsible for providing location lists, and its counterpart, which is responsible for receiving those lists, the care services update consumer. An example use case for mADX is a local hospital in Senegal which wishes to submit data to the National Level Health Management Information System, or HMIS. The hospital may make several queries to ensure that it has the most up-to-date versions of the mADX data structure definition, terminology, and provider lists. After validation, the hospital will submit the mADX indicator message to the National HMIS. In this use case, the content creator and content data structure consumer are grouped together. This diagram outlines the flow of this use case. As you can see, the content creator and content data structure consumer are grouped together. The content creator submits the aggregate report to the content consumer, the HMIS. The content data structure consumer validates the messages before they're sent. It retrieves the aggregate report definition, retrieves any related value sets, and finds the matching care services as defined in the MCSD profile. It may even do these actions in a loop in order to validate those messages as part of the submission. An alternate flow for this is where the content consumer, the receiver of the aggregate reports, is doing the validation. In this workflow, the content creator submits the report, then validation is done by the content consumer before sending back the acknowledgement. Once again, this can optionally be done within a loop. Here we have an example mADX message in JSON. This shows HIV indicators and is aligned with the IHE HIV profile. We have the relevant codes and scores available in this measure report. They would be defined in the related FIRE measure. Thank you for watching.